Influence of self-compassion on mental and emotional motivation for task completion. Null hypothesis. Practicing self-compassion has no effect on mental and emotional motivation for task completion. Alternative hypothesis. Practicing self-compassion has a positive effect on mental and emotional motivation for task completion. In recent years, self-compassion has become another notable tool an individual may utilize to become kinder, more patient, and more accepting of themselves. Individuals who actively practice self-compassion have better physical, mental, and emotional health and stamina, and are overall more satisfied with life. Self-compassion is considered a health-promoting behavior and has been found to help alleviate and curb stress, promoting a more positive attitude and an increased desire for healthier behaviors. There is a significant need for practicing self-compassion to allow self-kindness, self-acceptance, and self-patience to trump the associated emotional illness and stress related to self-criticism. Even with the many stated benefits and positive results claimed by practicing self-compassion, there has yet to be a study conducted to test the impact of self-compassion on the mental and emotional motivation for task completion, where task completion can be defined as goals, plans, or to-do lists. There are two current examples of research articles on self-compassion. The first article supports findings for self-compassion increasing self-acceptance, self-control, and inner calmness, while combating self-judgment, criticism, and harm. The second article supported findings for self-compassion increasing self-kindness, self-acceptance, and self-patience, while dispelling emotional illness and stress related to self-criticism. I believe the next step for researching self-compassion impact would be to see how self-compassion influences mental and emotional motivation for task completion. There have been plenty of times when I have been hard on myself and felt like doing nothing afterwards. I'm curious if the reverse is true. If the more self-compassionate I am towards myself, will that make me feel like completing more tasks throughout the day? How would this apply to the general population? For this research, I would like to use the convergent parallel design because it will enable me to use both qualitative and quantitative research designs and review the collected data from both methods side by side and independently. I would like to use the Solomon 4 group design for my quantitative research goals because it'll allow me to see where individuals have started and ended with their responses, and will allow me to use control and experimental groups. The Solomon 4 group will also allow me to work with individuals who don't have starting and ending responses, and allow me to work with a large group of individuals, which is a target of my study. For my qualitative research goals, I would like to use participatory action research. The concept of self-compassion has become increasingly popular over the last couple of years, and PAR has become the best qualitative research option for assessing self-compassion impact on participants. This specific study, PAR, is best paired with survey research for the data collection process, as PAR emphasizes the collection of personalized information of feelings, opinions, and patterns without manipulation or interference of the data. Researchers may ask relevant focus-based questions regarding self-compassion and receive uninfluenced and personalized answers. When researching self-compassion, researchers must have careful ethical consideration when withholding potentially effective research treatment from one group of participants while allowing another group to have complete treatment during the research study. Individuals struggling with self-rejection and self-criticism may feel pain and distress and should be approached thoughtfully. If treatment is going to be withheld, it must be for the greater good, minimizing risk and maximizing benefits. Should the treatment prove successful, participants who were withheld treatment during the research process should then be offered complete compensatory treatment. As stated by the American Psychological Association, if scientific or humane values justify delaying or withholding this information, psychologists must take a reasonable measure to reduce the risk of harm. Researchers must remain as transparent as possible, always minimizing harm and maximizing benefits. If treatment must be withheld for the benefit of the research, all possible risks must be minimized as much as possible. Self-compassion has become more and more popular in the practice of psychology and has been found to have many emotional and mental health benefits for the individual. It would be interesting to see what data may be collected on the idea of self-compassion influencing mental and emotional motivation for task completion. The convergent parallel design, Solomon four-group design, and participatory action design will be most helpful in aiding the research of self-compassion impact on individuals. If self-compassion should be found to increase the mental and emotional motivation for task completion, this may prove very helpful when working with individuals struggling with finding motivation to fulfill their day-to-day tasks and goals, aspirations and ambitions, and purpose in life. Thank you so much.